Hello and welcome to Pregnancy Info. Today we will discuss the benefits and risks of climbing stairs in pregnancy, especially in the 9th month. What is the role of climbing stairs? Is climbing stairs or walking uphill safe during pregnancy? Many women worried and wonder if it helps in natural delivery or it could cause harm. Today's video will explain everything trimester by trimester, including the benefit, risk, and expert tips for safe climbing in early, middle, and late pregnancy. So if you are confused whether to take the stair or the lift, this video is for you. Let's get started. Number 1, first trimester, which is last from week 1 to week 12. In this trimester, there are some pros and cons of climbing stairs. First, we will discuss the pros or benefits of climbing in first trimester. In early pregnancy, your body is still physically similar to its pre-pregnancy state. Your center of gravity hasn't shifted much and you may still have good balance and stamina. If you're feeling well, light stair climbing or mild uphill walking can help improve circulation and maintain basic physical fitness. Staying slightly active in the trimester supports heart health and builds endurance for the journey ahead. Now, cons mean risk of climbing in first trimester, but the trimester also comes with its challenges. Hormonal changes can cause you feel dizzy, nauseated, and extremely tired. Even during short physical activities, this makes climbing dangerous if you are not careful. The risk of tripping or fainting increases, especially on steep or poorly lit stairs, and while climbing itself doesn't cause miscarriage, the first trimester is the most delicate phase in terms of implantation and organ development. So, any fall or trauma can have serious consequences. What are the tips for the first trimester climbing? Climb slowly and only when necessary. Always use the railing for support and never climb if you're never feeling lightheaded or sick. Avoid climbing right after meals or when your stomach is empty. Both can cause drops in energy or blood pressure. Wear anti-slip shoes and make sure the stairs or slope is clean and well lit. Keep your steps small and controlled, and most importantly, listen to your body. If something feels wrong, stop immediately. Now, in the second trimester, which starts from week 13 and ends at week 27. What are the pros or benefits of climbing in second trimester? This is considered the safest and most comfortable phase of pregnancy. Energy levels are usually higher, morning sickness fades, and baby bump is not yet too heavy. It approved by your doctor. Moderate climbing during this trimester can help improve your stamina, strengthen legs and pelvic muscles, and support a healthy pressure. It also helps manage weight gain and keeps your cardiovascular system active, which can be beneficial for both you and the baby. Cons: risks of climbing in second trimester. As the bump starts growing, your balance begins to shift. The pregnancy hormones relax and loosen joints, especially in the hips and knees, which are increase the risk of strains or sprains. Overdoing climbing at this stage may also cause leg cramps or back discomfort. Additionally, any fast or unsteady climbing can raise your heart rate too much, which should be avoided during pregnancy. Oh, what are the tips? Climb at slow, steady pace. Always hold the railing or have someone nearby for support. Take breaks between flights or stairs or uphill steps. Stay well hydrated and wear clothes that allow your body to breathe. Avoid carrying anything heavy while climbing, and don't climb outdoors during hot or humid weather. If you feel even slight discomfort, pause and breathe deeply. Your goal is to stay gently active, not to push your physical limits. Third trimester, that starts from week 28 and ends at the birth. Pros: benefits of climbing in third trimester. In the last trimester, your body is preparing to descend into the pelvis. Gentle stair climbing with medical approval may help encourage the baby's head to move downward, which some believe helps promote cervical dilation and labor dilation. It also improves blood flows and helps reduce swelling in the legs by keeping circulation active. Cons or risks of climbing in third trimester. But this is also the riskiest time for climbing. Your belly is much bigger, balance is harder to maintain, and fatigue comes quickly. Even minor climbing can cause breathlessness, abdominal heaviness, or lower back pain. Worst of all, if you have complications like low-lying placenta, high blood pressure, or or a short cervix, climbing can increase the risk of early labor or falls. A small missteps can have serious consequences at this stage. Tips: only climb if your doctor has clearly permitted you. Always hold into a railing with both hands and climb one step at a time. Move slowly and never climb alone. Avoid carrying any weight, not even groceries or toddlers. If your leg feel weak or you feel back pressure, stop and sit down immediately. Make sure someone is around for support if you are at home. Prioritize safety above all. Labor is near and now is not the time to keep unnecessary risk away. Now, here is a question: how does stair climbing help open the cervix in the 9th month? In the 9th month of pregnancy, the baby starts moving down into the pelvis and the body begins preparing for labor. During this time, mild physical activities like climbing stairs are often considered a natural method to support the body's preparation for childbirth. Let's understand exactly how stair climbing can help in opening the cervix and encouraging normal delivery. Number 1. Help the baby move downward. When you climb stairs, your legs, hips, and pelvic muscles are actively engaged. This movement gently encourages the baby to move lower into the pelvis. As the baby's head presses downward, it naturally increases pressure on the cervix, which may help it to start softening and opening, a process known as cervical dilation, especially if your body is already close to labor. Applies gentle pressure on the cervix. Once the baby settles lower in the pelvis, it creates physical pressure on the cervix. Stair climbing increases this pressure gradually and gently. This pressure signals the body to begin the natural labor process, softening and thinning the cervix, called effacement, and eventually helping it open. Improves blood circulation. Climbing stairs also improve blood flow, especially to the lower body, including the uterus and pelvis area. Better circulation helps relax the muscles and tissues around the cervix and uterus, make it easier for the uterus to contract when labor begins. Naturally activates labor hormones. Light physical activity such as climbing stairs can naturally increase the level of oxytocin, the hormone responsible for triggering contraction. If your body is already getting ready for labor, a gentle boost in oxytocin can help things progress faster and more smoothly. But when you should avoid stair climbing in the 9th month? You should avoid climbing stair in these conditions: high blood pressure or preeclampsia, low-lying placenta, history of preterm labor, severe fatigue or breathlessness, dizziness or fainting. Always consult your doctor before attempting any activity in the last month of pregnancy. Stair climbing in the 9th month, if you're done with care and with the doctor's approval, can help move the baby downward, increase cervical pressure, and support your baby's normal labor process. But always remember, every pregnancy is different. Make decisions based on your health, comfort, and medical advice. Hope you have found this video useful. Must share this information with other pregnant women. Until next video, take care and bye-bye.